Good afternoon to everyone. I am Elango, nursing principal from KAPV Govt Medical College, Trichy. I am happy to take these classes to the nursing students. So today's topic is about the biological weapons. Okay. So the weapons means to attack others, isn't it? So this is the weapon to attack others by means of biological. The biological way to attack others, it is something different. Let's see what it is. The biological warfare agent. In this situation, the COVID-19 situation, that people are suffering a lot with the virus attack. So I cannot say anything about that, but except we suffer a lot. So this is actually says about the biological warfare agent. The first one is the anthrax, called bacillus anthracis. Especially the anthrax transmission is through the digestive system, skin and inhalation. Through inhalation, the anthrax virus passes into the person's body. No persons to person spread actually. The infection attacks the lymph nodes, blood and lymph nodes, and shock and death is very common in this anthrax. It is dangerous disease, anthrax. The treatment is only the ciprofloxacin, doxycycline and penicillin are common. This is biological, one of the biological warfare agent, the bacillus anthracis. The next is about the botulism by the Clostridium botulinum. Okay, this is the botulism disease transmit through the airborne, canned food, contaminated wound, and this is the disease shows with the dysphagia, muscle weakness, paralysis and respiratory paralysis. This botulism is a too dangerous disease. This can cause the patient life within 24 hours. The patient may die within 24 hours. The treatment is actually with the antitoxins, and you should make the patient to get vomit, and you should give the enemas to evacuate all the bacterium from the body. And penicillin is the treatment for this botulism. This is too serious. This causes muscle paralysis. This prevents the neurotransmitters to transmit the signals. This is about tularemia, otherwise known as a rabbit fever. Okay, this rabbit fever caused by the Francisella tularensis. Especially this is transmitted by the tick bite, deer, flies. Contact with the infected animals can cause this tularemia, which shows many signs and symptoms like fever, ulcerated skin lesions, lymph node enlargement, pneumonia, GI ulceration. The main treatment with the antibiotics. Recovery produces a lifelong immunity. Once the person gets the tularemia, automatically that produces some antibodies. Inside the body, in the immune system produces antigen-antibody reaction. Antibodies produced forever once the patient get this tularemia infection. That is called rabbit fever. This is about the plague. There are two types of plague called bubonic plague and pneumonic plague. You can see the picture now. This picture shows pneumonic plague. Just see the right side of the picture. Pneumonic plague says about the lung get affected. Okay, the entry and exits are same. That means eyes, nose and mouth. The exit also from the same place. The disease affects the lungs. This is pneumonic plague. Whereas if you see the bubonic plague, that you can see the bottom of the picture, you can see the number 1. Entry is bite of infected rat fleas through the skin. It transmits the infection and attack the lymph nodes. You can see the third one. This is buboes. Black hemorrhagic lymph nodes are present in the axillary region that you can see in the picture, and also it spreads with the lymphatic and systemic infections also appear. And this bubonic plague, a mode of exit is ears, nose, mouth and eyes are the exit, and mode of entry is through the skin, but not like pneumonic plague. These are all some differences between bubonic plague and pneumonic plague that you can understand. The plague, Yersinia pestis. Yersinia pestis, otherwise known as plague infection, transmission through rodent and fleas, persons to person. This is especially pneumonic and bubonic septicemic, and this is caused very serious issue that we have seen in the last picture. With the symptoms of fever, chest pain, lymph node enlargement, hemoptysis and respiratory failures are common in this plague disease. The treatment is only by the antibiotics, streptomycin and gentamicin. Vaccines are also available for the plague disease. There is also a biological warfare. Next is about the smallpox. There is a different types of biological weapon. There is also a weapon. It's too serious to say that I cannot say now. The smallpox transmission through air droplets, handling of contaminated material, fever, and it produces vomiting, malaise and headache. Papule vaccine is available. Papules are present over the skin. These are all the symptoms. Vaccines is available for the smallpox now. The next is about the hemorrhagic fever. The title itself, you can understand, this is hemorrhagic fever. Several viruses which causes hemorrhagic fever. Example, Marburg, Lassa, Junin and Ebola virus. Ebola virus is common in East Asia. Transmission is through rodent and mosquitoes. This spreads person to person. The hemorrhagic fever spreads through person to person through body fluids. With the symptoms of producing fever, conjunctivitis, hypotension, hemorrhage and organ failures are common in this hemorrhagic fever. There is too serious, no specific treatment for the hemorrhagic fever. So this is only about symptomatic treatment we can give. There is also a warfare. Do you understand what is warfare? It's a type of weapon to attack others. So far we have discussed about biological warfare. Now this is chemical warfare that you can understand. Major chemical warfares are sarin, phosgene, mustard gas, ionizing radiations are common chemical warfare. If you take the sarin, there is a toxic nerve gas. So death within minute of exposure. It is too serious. Enters through eyes, skin, respiratory paralysis happen for the patient. Is too bad to say sarin. Next is about the phosgene. There is a colorless gas used in chemical factories. Inhaled for longer time causes respiratory distress and death can cause. Phosgene. Next is about the mustard gas. This is yellow to brown color gas with garlic odor and irritates the eyes. Skin burns common. Blisters happen because of the mustard gas. This is also a chemical warfare to attack others. Next is about the ionizing radiation. There is external and internal radiations also there. Happens after substantial exposure period of. This causes electrolyte imbalances, neurological and cardiological impairment, hemorrhage and death are common in this ionizing radiation. There is also chemical warfare that you can see. So far we have discussed about the biological and chemical warfare to attack others. If you want further video, you can contact me through email or my phone number. Take down my email ID is relango209@gmail.com. My cell number is 8838878726. Thank you for watching. Bye bye.